Having type 2 diabetes significantly raises your chances of getting cancer. In fact, people with diabetes are now more likely to die from cancer than anything else. I'm not here to scare you. I'm here to empower you with information that could save your life. So if you're living with diabetes, pre-diabetes, insulin resistance, and especially if you've already had cancer, this is a very important video for you to watch. I'll be going over why people don't even realize they have high blood sugar or insulin issues until it's too late, how these can lead to cancer, and most importantly, the simple changes you can start making today to significantly lower your risk. And I'm not just going to tell you to eat more broccoli and less sugar. We're going far deeper than that on how to lower inflammation and insulin resistance, two big drivers of several health conditions, including cancer. Most people don't realize how much inflammation they have in their body or how insulin resistant they are. But right now, 1 in 3 people walking around are insulin resistant without a clue. This is when your body stops using insulin properly, so sugar builds up in your blood instead of going into your cells for energy. And that extra sugar doesn't just sit there. It fuels inflammation, it adds fat, and it's one of the strongest drivers of cancer because cancer cells love sugar. And we now know that lowering your insulin resistance is one of the most powerful things you can do to stay healthy. But here's the frustrating part. Most doctors don't actually test for insulin resistance. They'll look at your blood sugar, and if that's in the normal range, they'll send you home with a clean bill of health. And the problem with that is your body could be struggling for years with insulin resistance before your blood sugar ever shows up as high on a test. So if you've been eating a lot of sugar for years, there's a good chance your cells have stopped using insulin like they should. So your pancreas has to work harder. It has to pump out more and more insulin just to keep your blood sugar levels normal. But over time, it just can't keep up. And that's when type 2 diabetes kicks in. Sugar spills into your bloodstream, and finally your doctor sees it on a test. But by then, the damage has already started in your blood vessels, your nerves, and even in your body's ability to get rid of cancer cells or precancerous cells. But here's something your doctor likely won't tell you. Type 2 diabetes can be reversed. Unfortunately, our healthcare system is more focused on managing symptoms with medication instead of fixing what caused the problem in the first place. Which leads us to an important question most people don't even think to ask. Well, if I'm managing my diabetes effectively with medication, doesn't that protect me from getting cancer? Unfortunately not. These medications just mask the symptoms. But if you're still eating sugar and not making any lifestyle changes that likely caused diabetes in the first place, you're still at a very high risk of getting cancer. A lot of people also ask me if pre-diabetes is just as dangerous as full-blown type 2 diabetes. No, not quite. Think of pre-diabetes as the warning light on your car dashboard. If it just went on, you have an opportunity to fix the problem. But type 2 diabetes, on the other hand, is when that warning light has been on for too long and it's already caused real, measurable damage. Now listen to this. For decades, stroke and heart attack were the #1 killers for people with diabetes. But recent studies have shown that these numbers have dropped a lot. That's great news. The medications for blood pressure and cholesterol are much better now than they ever were, and screening for heart disease and stroke is getting better too. And on top of that, there's a bigger push for people to start making healthier diet and lifestyle changes. So all of this has helped push the cardiovascular deaths down in people with type 2 diabetes. But while heart attack and stroke-related deaths have gone down, cancer-related deaths are climbing. And why is that? Because having high blood sugar doesn't just damage your heart and your arteries, it also fuels cancer cells. Because cancer cells love sugar more than anything else, they thrive in the very environment that type 2 diabetes creates in your body. Chronic inflammation, insulin resistance, and elevated glucose. And it's not just any type of cancer driving these numbers. People with type 2 diabetes are particularly at a higher risk of liver, pancreatic, colorectal, and endometrial cancers, to name a few. And when some of these cancers appear, often they're late stage and more aggressive, so they're harder to treat. It's really scary, I know. So what can you do starting today to lower your cancer risk if you have prediabetes, type 2 diabetes, or other blood sugar issues? The first thing that likely comes to mind is cutting back on sugar and refined carbs like white bread or white pasta. And yeah, that's a big step. Those types of foods cause your blood sugar to spike more than anything else. But I'm going to let you in on a secret today. It's something most people don't know. One of the fastest ways to reverse insulin resistance isn't just about what you eat, it's about when you eat. And that's where intermittent fasting comes in. Fasting gives your body a much needed break from constantly digesting food. When you do that, your insulin levels drop and your body finally switches out of storage mode, where it's holding on to sugar and fat, and it moves into repair mode, where it can heal, burn fat for fuel, and lower inflammation by a lot. Think of it as giving your body a reset button. And even short fasting windows are better than nothing, like skipping late night snacks and eating only within an 8-hour eating window each day. Even that can make a big difference over time. Now, of course, if you're on medication for diabetes or anything else for that matter, please talk to your doctor to make sure fasting is safe for you. But for most people, it's a safe, free, and powerful tool you can start using right away. I actually have another video on how to make fasting even more effective, so you'll want to check that one out next. But one of the things I go over is when fasting is paired with exercise, especially strength training. Maybe that's not what you were hoping to hear, but it's a big one. Research shows that strength training can lower your risk of cancer by up to 60%. That's not a small number. That's life-changing, which is why I always say exercise is a non-negotiable. And don't worry, I'm not trying to say you need to run a marathon or spend hours a day at the gym. Something as simple as buying a pair of dumbbells and lifting them while you're watching TV on the couch, even that can do wonders. And if that feels like just too much right now, just start walking more. Especially if you can go for a walk right after a meal or take the stairs instead of the elevator. Every bit counts. Now, just like fasting, strength training makes your body more sensitive to insulin, but it also gives your immune system a boost. And since your immune system is your body's main defense against cancer, this is really important. The stronger your immune system is, the better it will be at spotting and destroying abnormal cells like precancerous cells before they can turn into something dangerous. And as a bonus, strength training also helps to protect your bones. So exercise really is medicine, and the best part is it's free. And the reason I say strength training specifically is best is because the more muscle you have, the less insulin resistant you'll be. Muscles act like a sponge for sugar in your blood. They store glycogen, which is your body's natural way of storing carbs to use as energy for later. So the more muscle you have, the more room your body has to store that sugar safely, instead of letting it just hang around in your blood where it causes damage. So basically, anytime you build even a little bit of muscle, you're giving your body a better chance to reverse type 2 diabetes, fight insulin resistance, and ultimately cancer. But while muscle gives your body a fighting chance, too much excess fat can actually do the opposite. Obesity often goes hand in hand with type 2 diabetes, but the good news is you don't need to drop 50 pounds tomorrow to start making a difference. If you're overweight, losing even 5 to 10% of your body fat can dramatically improve your health. Small, steady progress really adds up. Intermittent fasting is great for weight loss, and so is strength training. And if you can combine those two with a healthy diet, you're winning. You can start to reverse insulin resistance and come off type 2 diabetes medication. Obviously, it won't happen overnight, but it is certainly possible. One more crucial thing to mention here is if you have type 2 diabetes, or even pre-diabetes, or you suspect you might be insulin resistant, regular cancer screenings become even more important. Seriously, don't put them off. Things like colonoscopies, mammograms, pap tests, they're non-negotiable. When cancer is found early, treatments work so much better. So staying on top of them isn't just smart, it could save your life. And if you want to hear more about how intermittent fasting is amazing for lowering your cancer risk, check out this video next, and I'll see you next week.